picture this. You're sitting in a doctor's office, right?
Oh, perched on that awful exam table.
Yeah, exactly, with the crinkly paper.
Yep.
And your appointment was supposed to start like 10 minutes ago. You're feeling anxious about some strange symptom you've been having, so what do? You pull out your phone.
We have all been there.
Right. Frantically searching for symptoms, trying to figure out if your persistent cough is, I don't know, just allergies or something that requires an emergency room. But the landscape of that whole waiting room behavior, it has fundamentally shifted.
Oh, completely. The scale of the shift is just remarkable.
Yeah, because we aren't just typing isolated keywords into a search bar anymore. We are having these deep, interactive, highly detailed conversations with artificial intelligence about our health.
Right up until the moment the doctor turns the doorknob.
Exactly. And that transformation is our focus for today's deep dive.
Welcome in, everyone. We are looking at a really fascinating study from 2026. It was published in the Georgian Medical Journal. It's titled Artificial Intelligence-Informed Patients and the Transformation of Doctor-Patient Communication.
Yeah, and what makes this research stand out isn't just the topic itself, but how they actually gathered the information. They didn't just pull abstract hospital data.
No, they went right into the field.
Right. They went into outpatient clinics in Kutaisi, Georgia, and literally sat down face-to-face with 127 adult patients.
And 45 physicians, too.
Yeah, to figure out exactly why these tools are being used and how they're altering the actual dynamic inside the exam room.
Which is so valuable. It gives us this crucial window into the current reality of clinical practice.
Totally.
It moves past that whole theoretical debate of, what generative AI might do in the future. Instead, it captures the empirical evidence of how it's actively changing patient expectations and physician workflows right now.
Right. Which brings us to our mission today. We're going to explore that changing dynamic. We want to see how conversational AI is fundamentally rewriting the script of the doctor-patient relationship.
And why bringing a chatbot into the medical equation is changing the very definition of what a doctor actually does.
Yeah. So I want you, the listener, to think about the last time you prepped for a medical visit. Did you run your symptoms through an AI tool?
A lot of people do.
And perhaps more importantly, did you actually tell your doctor about it?
Yeah, those two questions really sit at the very heart of the friction we're seeing in exam rooms today.
So to understand that friction, we first have to look at the sheer volume of patients engaging with these tools. I mean, the baseline data from this study just establishes how normalized this has become.
It really has.
Okay, let's unpack this, because the scale of this shift is what really caught my eye. We already know that searching for health info online is common, right?
Sure.
The study notes that 76% of surveyed patients do it. Like, Dr. Google has been around for a couple of decades now.
Oh, yeah, doctors are very used to Dr. Google.
But the new reality is that a massive 68% of patients are specifically using AI-based health tools prior to their consultation.
68%.
Right.
That is huge.
Right. More than two-thirds of the people sitting in that waiting room have already had a preliminary diagnostic conversation with an algorithm.
And when you view that from the physician's side of the desk, you see how heavily it impacts their daily practice. The research indicates that 87% of the doctors surveyed encounter AI-informed patients at least monthly.
Wow.
Yeah, but the frequency is actually much higher for a big chunk of them. 53% are dealing with this dynamic on a weekly basis.
Every single week.
Exactly.
So we need to separate the old internet search from what's happening now with generative AI. The study emphasizes that generative AI synthesizes complex medical knowledge, right? It provides interactive responses that resemble actual clinical dialogue.
Yes. It's a totally different experience.
Think about it this way. The old Dr. Google was like going to a vast library and pulling down a very confusing, disjointed medical encyclopedia.
Right, and you had to piece the puzzle together yourself.
Yeah, cross-referencing different articles, and honestly, usually feeling more confusing when you started.
Ab-
But generative AI is entirely different. It's like having a highly confident, incredibly articulate, but totally unlicensed medical student whispering a cohesive theory in your ear right before the doctor walks in.
What's fascinating here is the psychological impact of that cohesive theory. It is profound.
How so?
Well, because the AI is mimicking the tone and structure of an actual clinical dialogue, it creates this powerful illusion of medical certainty.
Oh, I see.
Yeah, a traditional search engine yields raw data. It forces the patient to acknowledge that they're just sifting through disparate pieces of information. Generative AI, however, bridges the gap between that raw data and synthesized advice.
It builds a story out of your symptoms.
It does. And to understand why that matters, we have to look at how large language models actually function. They are not diagnostic engines operating on clinical logic.
Right.
They're predictive text engines operating on statistical probability.
Okay, that makes sense.
So when a patient inputs their symptoms, the AI predicts the most likely sequence of words based on its massive training data. It frames the symptoms, suggests possibilities in this really reassuring professional tone, and effectively alters the patient's entire mindset.
Wow. So they become anchored to that generated narrative before the human physician even begins their assessment.
Exactly. They are primed.
The patient is walking in feeling like the heavy analytical lifting has already been done. They have the narrative, they have the medical terminology.
And they're essentially arriving just for the doctor to validate the AI's conclusion.
Right. They're no longer a blank slate seeking guidance.
No, the informational environment of the clinical encounter has been completely reshaped. It's gone from a one-way flow of expertise to a collision between the doctor's clinical judgment and the AI's probabilistic output.
Here's where it gets really interesting, though. Because generative AI is so good at mimicking that confident tone, you would think patients would proudly walk into the clinic and say, hey, look what I found. Let's talk about this.
You would think so.
Right. If it's shaping their expectations so profoundly, you'd assume it's the main topic of conversation. But the data reveals the exact opposite reaction.
Yes, the researchers identified a significant communication gap. Despite those high utilization rates, only 42% of patients actually disclose their use of AI tools during their consultations.
42%. That leaves a 58% majority of patients who are actively sitting on AI-generated health info.
Just keeping it to themselves.
Yeah. They're bringing those specific expectations and anxieties into the room, but they're keeping the source of those expectations a total secret from their physician.
They're holding a secret second opinion.
A secret second opinion. I like that phrasing.
And the implications for the clinical encounter are immensely disruptive. I mean, a successful medical consultation relies entirely on trust and open communication. The doctor needs the full context of the patient's concerns.
So why the secrecy? If you listening to this have ever done this, what stopped you from mentioning it? Are patients hiding this because they feel embarrassed?
That's certainly part of it.
Because there's this known stigma, right, around being perceived as a hypochondriac or a difficult patient who spends way too much time on the internet.
Oh, absolutely.
Or, and this feels like a much more complex dynamic, are they secretly testing the doctor?
Both of those motivations carry a lot of weight. On one hand, patients are highly aware of the Dr. Google fatigue that many physicians experience.
Right, doctors roll their eyes at.
Exactly. And patients want to avoid being dismissed, so they hide the AI used to protect their credibility. But on the other hand, using the AI as a hidden benchmark is a way for patients to navigate the historical power imbalance of medicine.
Oh, that's interesting.
If a patient has felt ignored in past medical encounters, they might use the AI as a shield. They listen to the doctor's assessment and silently cross-reference it against the chatbot's output to decide if they even trust the human expert.
Wow. And that puts the doctor in a bizarre psychological position.
Very much so.
They aren't just diagnosing a physical ailment anymore. They're trying to read the patient's mind. The doctor's trying to figure out, why is this patient suddenly asking highly specific, targeted questions about a rare autoimmune disorder when they just came in for a minor rash?
The physician is operating at a severe disadvantage. They're trying to address deep-seated concerns that haven't even been explicitly stated.
Yeah.
It undermines the whole shared decision-making model that modern medicine is built upon. The doctor is forced to shadowbox with an algorithm.
Shadowbox with an algorithm.
Yeah, trying to dismantle a hidden diagnostic narrative that they can't even see.
That is a perfect way to describe it. It must take an incredible amount of energy to manage that dynamic. Which brings us to what happens when that shadowboxing stops. Like when the patient actually does put their cards on the table.
Right.
When the AI info is brought out into the open. How do doctors actually evaluate the medical advice these models are giving? And what does that do to the actual flow of the visit?
Well, the study asked physicians to evaluate the accuracy of the AI-generated information that patients brought to them.
Okay.
18% is the baseline for completely accurate information.
Just 18%.
Just 18. In 20% of the cases, the info is deemed completely misleading. But the most significant category is the middle ground. 62% of the time, the AI-generated information is evaluated as partially accurate.
Okay, 18% is a strikingly low figure for a tool that speaks with such absolute confidence.
It really is.
But I want to push back on how that middle ground affects the actual consultation, because the study highlights this counterintuitive statistic regarding time.
Right, the time tax.
Yeah, it notes that 60% of physicians reported that consultations with AI-informed patients actually require additional time. But wait a second, shouldn't prep make things faster?
You'd think so?
Right. If the patient comes in already educated on their symptoms and they've already articulated their history to a chatbot, why is it taking the doctor more time, not less?
If we connect this to the bigger picture, the answer lies entirely in that 62% partially accurate category.
Okay.
In medicine, dealing with partially accurate information is vastly more time-consuming than addressing something that is just completely absurd.
How so?
Well, if an AI tells a patient a common cold is actually a rare tropical parasite, the doctor can quickly and easily debunk that 20% misleading information. It's obviously wrong. But partially accurate information is insidious.
Because it's usually built on a grain of truth.
Exactly. It sounds highly plausible because it utilizes real medical concepts. They're just applied incorrectly.
Right.
Like we discussed earlier, the AI weaves a probable narrative.
Right.
The issue is that the AI fundamentally lacks the patient's personal clinical context. It doesn't know their nuanced family history or their specific lifestyle factors or those subtle physical cues a doctor observes in the room.
Yeah.
So the AI generates a beautifully synthesized, highly logical narrative that is medically sound in a vacuum, but practically flawed for the specific individual sitting on the exam table.
So, like, if a patient comes in with fatigue and joint pain, the AI might pull up a highly detailed, medically accurate explanation of rheumatoid arthritis.
Yes.
Because statistically, those terms are linked in the training data. The AI isn't wrong about what rheumatoid arthritis is, but it's entirely wrong that this 25-year-old patient who, say, just started training for a marathon and isn't sleeping has it.
That is a perfect example. And untangling that takes immense effort. The extra time isn't spent arriving at the correct diagnosis of physical exhaustion.
Right.
The extra time is spent carefully dismantling the AI's partially accurate narrative about rheumatoid arthritis.
And the doctor has to be incredibly tactful about it, too. You can't just tell the patient their chatbot is stupid.
No, you can't.
Because the patient is emotionally invested in that research.
The communicative burden is massive. The physician has to validate the parts that AI got right so the patient feels heard. They have to gently correct the misleading parts without coming across as defensive or dismissive. And then they have to contextualize all of it to the patient's actual physical reality.
Which takes a lot of skill.
It does. They are not starting the consultation with a clean slate. They're starting with a messy, half-finished puzzle that an algorithm forced together. Rebuilding that puzzle correctly requires cognitive and emotional labor that naturally extends that 15-minute consultation window.
You're essentially doing two jobs at once. You're diagnosing the human being, and you're fact-checking the robot.
Exactly.
And that extra effort, that time tax, isn't just a scheduling annoyance that causes the waiting room to back up.
Yeah.
The study argues that this extra time represents a profound philosophical shift in what it means to be a healthcare provider.
Yes. The authors draw a very clear conclusion from their findings. AI is actively reshaping the informational environment of clinical encounters. Historically, the medical profession operated on a model where the doctor was the oracle. Patients went to the clinic because the physician held a monopoly on specialized medical knowledge.
The doctor had the textbooks memorized. You presented the symptoms, they provided the answers. It was this unidirectional flow of expertise.
But the reality captured in this study demonstrates that AI is redefining that role. Knowledge is now democratized and instantly synthesized by algorithms. Doctors are no longer the sole source of medical information.
Right.
Instead, they are transitioning into the role of interpreters and contextualizers of externally generated health data.
So what does this all mean? Like, for the profession moving forward, it means the foundational paradigm has shifted. The doctor of the future, and based on the Kutaisi data, the doctor of today is no longer just a primary diagnostician.
No.
Their most critical value is becoming a medical fact-checker and an AI translator. They're the human filter applying judgment, empathy, and physical context to a sea of algorithmic output.
This raises an important question, though, about how the medical field is actually preparing its workforce for this new reality.
Yeah, how do you train for that?
Well, the study concludes with a very clear call to action. Medical education and healthcare practices must formally integrate digital health literacy and AI communication competencies into their training.
Okay.
For generations, medical schools have spent years teaching students the art of bedside manner, how to take a comprehensive history, how to listen actively, how to deliver difficult
The
news.
human elements of care.
Exactly. But now that training must expand. We need to teach physicians how to talk to patients about algorithms. We need to train doctors on how to tactfully navigate a consultation where they suspect the patient is secretly holding a second opinion from a generative model.
Right.
Digital health literacy is no longer just a concept for public health campaigns aimed at teaching patients to spot misinformation. It has become a mandatory core clinical skill for the physician.
It adds an entirely new layer of empathy and communication to the job. You aren't just treating the physical body anymore. You're actively managing the patient's relationship with their technology.
And doing it in a way that rebuilds that crucial foundation of trust. If a patient feels comfortable enough to share their AI research without fear of judgment, the physician can spend less time shadowboxing and more time collaborating.
It is a fascinating evolution of a profession that is, thousands of years old. And it brings us right back to you listening to this deep dive. The takeaways here are incredibly practical for your own life and your own healthcare.
They really are.
The next time you prepare for a doctor's visit, and the data says there is a 68% chance you will consult an AI tool before you go to the ship, remember the doctor's shifting role. They are no longer just the oracle dispensing rare knowledge. They are your contextualizer.
And to contextualize effectively, they require the full picture of what you're thinking and what you have read.
So don't be part of the 58% who hide their AI use in the waiting room. Bring it up early in the appointment.
Yes, please do.
Tell them, hey, I ran these symptoms through an AI, and it suggested a few specific things that I'm anxious about. Can we walk through why those do or do not make sense for me?
Exactly.
Help your doctor help you by putting all the conversational cards on the table. You'll save them the time tax of untangling a hidden narrative, and you'll receive better care because you're allowing them to do what the algorithm simply cannot do.
Which is apply human judgment and clinical context to your unique life, transforming a potential source of friction into a transparent, collaborative tool that is the ultimate goal for this new era of patient communication.
Now, before we wrap up today's deep dive, I want to leave you with one final provocative concept to mull over.
Okay.
We spent a lot of time discussing how physicians currently rate AI as completely accurate only 18% of the time, and how that forces the doctor into the role of a meticulous fact-checker. But generative technology is accelerating at an unprecedented pace.
Oh, it's moving incredibly fast.
Right. So as these models ingest more complex medical data and refine their probabilistic reasoning year after year, what happens when that 18% accuracy rate eventually inches closer to 90%, or even 99%?
That is the horizon line the medical community is rapidly approaching.
And when we reach it, if the AI eventually becomes the ultimate, nearly infallible diagnostician, how will the doctor's role be forced to shift yet again? If the machine rarely gets the diagnosis wrong, will the human doctor's primary value strip away from analysis entirely?
It's a huge question.
Will it become purely about emotional support, complex physical procedures, and the comfort of human touch? It is something to think about the next time you're sitting on that crinkly paper, phone in hand, waiting for the door to open. Thanks for joining us for this deep dive into the changing world of medicine and AI. We'll catch you on the next one. Keep questioning, keep learning.